Hi guys, this is Partha, and hope you're doing good. Hope you're indoors. Hope you're staying, following the protocols. The reason why I did this, to make sure that my messages reach out to you guys. So you should always sanitize your hand. If not, wash your hands. This is my humble request. We all can avoid coronavirus. See, coronavirus can be avoided. It can be stopped, to spread to different community, the 3-stage and all those things. Even I'm not that expert in the coronavirus, but we should follow what the government, what the doctors and all say. Okay, this video is not about the coronavirus. This video, what I'm trying to do is, so 3 things I wanted to discuss today. The first thing is the neuro disorder patient, like spinal cord injury, bullet injury, stroke, paralysis, and a lot of children having autism, cerebral palsy, spinocerebellar ataxia, MSA. So these are a bunch of diseases when falling in neuro disorders, wherein I see a lot of people are not getting any cure. Very similar to the thing which I have discussed in my past videos also with my father-in-law case. So what happened when he fell down and broke his C3C4 here, C3C4, and the doctor said us, he will be in his bed. So we had 2 choices. Basically, we had 2 choices. The choice number 1, to understand, to go with the flow what the doctor is saying. The second thing is to break the myth and look around if there is any other treatment that is available to help these guys. That's where realize, fortunately I come from a healthcare industry. Have spent 10 to 12 years of my expertise in pharma companies, understand the clinical trials, the effectiveness of a drug, how it helps a patient, and also how this thing goes, research of 15 to 20 years, again submitting into the FDA, post approval of the FDA, it goes into the human clinical trials, what is happening right now in COVID as well. So not going into that, and also have spent a little bit time on the payer side of it, the US payer side of it, to understand how many patients does come into hospital more and more often, which disease area, the risk adjudication. Basically, these are some terminologies wherein we understand which are the risk patients who come to and fro, they're like they enjoy hospital as their home. So I was coming to the point, why I brought up this story, because I've been in the healthcare industry, so I was not that familiar with stem cells or with any other regenerative medicines. So when I stumbled upon stem cells, and basically we determined to go with the second choice, the 2 choice from the doctor. Okay guys, if you don't know me, my name is Partha. You're wondering who is this guy, giving you advice and speaking and all. My name is Partha. I am with Enkel. I'm the founder and CEO. If you have not subscribed to my channel, it's a humble request to subscribe. A big shout out to all those guys who have helped me in subscribing till now. A very big thanks to all those guys. So my channel will be mostly focused on the specific treatment, the advancement of medicines, what are the new devices, which are the options a patient can take. These are what my channel focuses on, and I am trying to make sure that every week I have a specific expert speaking on a regenerative, or speaking on a medicines, or speaking on something which is more advanced, which can bring value to the patient. So similarly, coming back to my father-in-law's story, so what I realized is, when I went to the clinic, I saw small children, there's been 7 months, 8 months of children, till I saw 87 years of one adult. He had dementia, short-term memory loss basically. This all happens because of the neuro disorders. So not exactly neuro, we have people wherein I have seen the vision is going down because of glaucoma or retinal pigmentation or optic nerve disorder. That is one part. The second part is what else? So I have seen chronic kidney cases without dialysis, pre-dialysis. getting better, the creatine level is coming down, the liver cirrhosis is getting better. So guys, I have an interview coming up this Friday with one of the stem cell scientists and expert who will be briefing you on basically those 3 questions which any patient has. Question number 1, why patients are going aggressively on stem cells where FDA has not approved it. Question number 2, why doctor advised against it. Question number 3, percentage of patients getting better and the success rate. I don't want to enter into the FDA and all, but I know one thing which I had done a research from market growth and alternative regenerative medicines. What they say is the stem cells market is growing exponentially. It is expected to reach 250 or 270 billion USD by 2025. Oh, that's a huge number. The last thought which I wanted to give you guys, FDA has approved to process T cells. The T cells are extracted from stem cells. Stay tuned. Please subscribe to my channel. Listen, how a patient can get better, how a patient with disabled from neck, from hip can able to walk again. Is it a gimmick? Is it a magic? Or is it our own biogenerative which we are using again to get better? This is Partha. I would request you to please subscribe to my channel. It will help a lot of other people who are looking forward to information like this. Thank you. You have a good day, guys. Stay indoors. Make sure you use this.